Rhabdomyosarcoma, RMS, is a rare type of soft tissue sarcoma that arises from muscle cells. The two main types are umbilical RMS and alveolar RMS. Treatment for RMS depends on the type and stage of cancer. The main treatment options are surgery. For localized RMS, surgery is usually the first treatment done to remove as much of the tumor as possible. The type of surgery depends on the size and location of the tumor. For some tumors, limb-sparing surgery may be an option to remove the tumor while keeping the arm or leg. For tumors that have spread, surgery may not be possible. Chemotherapy. Chemotherapy uses anti-cancer drugs to destroy cancer cells. For RMS, chemo is usually given before and/or after surgery to try to kill any cancer cells that may have spread. The chemo drugs most often used are vincristine, actinomycin D, cyclophosphamide and ifosfamide. Combination chemo using multiple drugs is the standard treatment approach. Chemo may also be given systemically or delivered directly into the spinal cord, intrathecal chemo, to prevent cancer spread to the brain or spinal cord. Radiation therapy. Radiation uses high-energy X-rays or other particles to destroy cancer cells and shrink tumors. Radiation may be given after surgery and chemo to destroy any remaining cancer cells and reduce the risk of recurrence. For some patients with localized resectable, removable, tumors, radiation alone may be used. Sometimes proton beam radiation may be used for tumors near the eye or in hard-to-reach places to try and limit damage to nearby healthy tissues. Targeted therapy. Targeted therapies are newer drugs that target specific vulnerabilities within cancer cells. Imatinib is a targeted therapy drug sometimes used to treat certain types of RMS that are related to a genetic change known as a PAX3 FKHR fusion gene. It works by inhibiting proteins important to cancer cell growth. Other targeted therapies and early testing against RMS include inhibitors of MYC, PEAK/ACT/mTOR pathways and DAC inhibitors. Stem cell transplant. For patients with advanced, recurrent or refractory RMS, stem cell transplants may offer a chance at long-term control of the cancer. In a stem cell transplant, the patient receives high-dose chemotherapy, sometimes along with total body irradiation, in an effort to destroy cancer cells in the body. This treatment also destroys the bone marrow, which produces new blood cells. Then the patient receives an infusion of their own stem cells, autologous transplant, or donor stem cells, allogeneic transplant, which go to the bone marrow and start producing new blood cells. This resets the immune system. Transplants have more side effects than other treatments, but they may provide a chance at cure for certain high-risk patients when other options have failed. Treatment for mesothelioma usually involves a combination of treatments depending on the stage of cancer and overall health of the patient. The main treatment options include surgery. For early-stage mesothelioma near the outer layer of the lung or abdominal cavity, surgery may potentially cure the cancer by removing it. The most common surgery is called extrapleural pneumonectomy, which removes one whole lung and the lining of the chest wall and diaphragm. Sometimes a partial lung removal or decortication is done instead. Lymph nodes near the tumor are also often removed to check for spread. Surgery has the most side effects but offers the best chance of cure if all visible cancer can be removed. Chemotherapy. Chemo is usually recommended after surgery to try and destroy any remaining cancer cells that may have spread too small to see. The platinum-based chemo drugs cisplatin or carboplatin are most commonly used, often combined with another chemo drug like pemetrexed or raltetrexed. Pemetrexed alone is also an option. Chemo can also be used as the main treatment for unresectable mesothelioma to help control symptoms and potentially extend survival. Common side effects include nausea, fatigue, low blood cell counts and mouth sores. Radiation therapy. For mesothelioma, radiation is usually only recommended after surgery to destroy any remaining cancer cells. It may be delivered internally using brachytherapy seeds placed directly into the chest, or externally with high-energy X-rays. Intensity-modulated radiation therapy, IMRT, allows more precise targeting of radiation beams directly at the cancer while avoiding nearby normal organs as much as possible. Other localized treatments, for mesothelioma that cannot be removed with surgery, other local therapies may be used to directly treat the tumor. This includes things like heated chemotherapy, hyperthermic chemotherapy, where chemo is delivered inside the chest during a procedure, or cryoablation, which freezes the tumor using cryoprobes inserted into the chest. Photodynamic therapy uses a light-activated drug to destroy cancer cells in the chest lining. Targeted therapy. Two targeted therapies have shown benefit for mesothelioma, pemetrexed and bevacizumab. Pemetrexed interferes with cancer cell growth and bevacizumab inhibits new blood vessel formation supplying tumors. They are most often combined with chemo. Other novel oral targeted therapies under investigation include selumetinib and ruxolitinib. These target specific mutated genes found in mesothelioma. Palliative care. For patients with advanced mesothelioma that has spread beyond treatment options, palliative care aims to reduce pain, discomfort and distressing symptoms from the cancer and treatments. Therapies to control symptoms like pain, cough, breathing problems, blood clots and more help patients feel as well as possible for as long as possible. Palliative surgery may relieve symptoms like fluid buildup. Radiation can help with certain painful bone tumors. As you can see, the main treatment options for both RMS and mesothelioma are usually a combination of surgery, chemotherapy, and radiation therapy depending on the specific type and stage of disease. Ongoing research continues to improve new targeted therapies and supportive care options to address these aggressive cancers. The goal for both is maximizing survival duration and quality of life based on an individual patient's prognosis and goals of care. I hope this detailed overview examination of the various treatment approaches was helpful. Please let me know if you need any clarification or have additional questions.